Hi, my name is Katie Baum, and I'm a senior nursing student at the University of St. Francis. And today I want to talk to you a little bit about case management nursing. Case management can be traced back as far as the 1860s in the United States. At that time, immigrant families utilized people from charities to handle needs and follow-up care for the poverty-stricken. At the end of the 1800s, Lillian Wald practiced case management in the community as she handled and organized public health nursing. Currently, a case manager can be an RN, a social worker, physician, pharmacist, or a teacher, but today I'm going to focus on the nursing role. There are 3 levels of education preferred for someone in order to be a nurse case manager. This requires on-the-job training, continued education, graduate work, and postgraduate work. A current matter of debate is what level of education is enough for a nurse to practice as a case manager. Currently, a BSN degree is the minimum required education. There are many roles that the nurse case manager can fill. The primary role is to coordinate a more fluid continuum of care. This is established through collaboration and organization with physical therapy, occupational therapy, physicians, primary care nurses, the patient, and the patient's family. The case manager helps facilitate optimal versus inadequate patient outcomes, manages financial aspects of patient care so as to make the best use of resources, and a case manager is a patient advocate in such matters as physician's orders, insurance or lack of insurance, and even making ethical decisions. A nurse case manager follows the American Nurses Association Code of Ethics, Standards of Professional Performance, and a special code of ethics for case managers. Another role of case management is to develop a care plan or care plans that are evaluated on a daily basis and formulated using nursing diagnoses. These care plans help the patient to achieve the optimal outcomes the case manager is focused on. The roles of a case manager continue to evolve. Each hospital manager has a different idea about the role the case manager will fill, and a case manager may even base their work on a model that has been developed by people with more experience in their field. Now, the salary for nurse case managers can vary greatly state to state based on the demand for them in the area. But the average salary of a nurse case manager in the United States is somewhere between $60,000 to $69,000 a year. There is a higher demand for the nurse case managers currently within hospitals, long-term care settings, home health care, hospice, and even within the community. As economic times become more challenging, there will probably be an increased need for focused and well-managed care, and the nurse case manager is perfectly suited to help fill this role and to coordinate this continuum of care. There are a few future trends in case management that I'd like to look at real quick. As technology develops, consumers are not always aware of the cost associated with new treatments or medications. The role of case management will be important so as to direct healthcare in responsible ways. As healthcare reform takes place in this country, the use of nurse case managers may be increased so as to decrease the effects of diseases and manage outcomes in a more cost-effective manner. Nurse case managers will also be focusing more of their care on the elderly population, as this group continues to grow in the United States and requires some direction when making healthcare decisions.